Okay, so that's going. So Jean's one's going. So I'll just come back.
Oh, do you have George's number?
And I'll just say go live. Okay, just checking the connection. Now we're live. Fantastic. Okay, hi everybody. I am here this evening with Tracy Mountford. Immense pleasure to have you around, Tracy, to have a chat.
Thank you very much.
If you don't know Tracy, Dr. Tracy Mountford is one of the best known cosmetic doctors in the UK. You have been doing this for
30 years.
30 years. That is a while. And I have known you for about 20 of them, I think.
I know, it's worrying.
Yeah, so, fab, we got some people coming in. Hello, everybody. So I still get completely overexcited when I see that there are real people there. And I'm just making sure that you are in the... Do I move the camera? Do I move Tracy? Right.
I do.
No. And we are going to chat about, I don't know, things that you wanted to ask, but also about things that bother us in aesthetics. So anyway, what should we kick off with as a question here? You do an awful lot of CoolSculpting and art therapy as well as all the injectables.
Yeah.
And there were a couple of really good CoolSculpting questions that have come in, so I thought we would warm up or cool down with those. So, CoolSculpting, is CoolSculpting the equivalent of a tummy tuck?
The short answer to that is no.
Yep.
It's not. I mean, if surgery is necessary, and you and I both know, you know, those real aprons where you've got the really lax skin.
Yes.
CoolSculpting is not going to touch that.
Yeah.
I think that the broadest way I can explain the way CoolSculpting would be of most value to a patient is when you've got just a bit of excess fat, something you can just grab.
Grabbable fat.
Yeah, grabbable
yeah, I
fat.
love that phrase. Yeah, we all know what that means.
We all know
don't
that.
we? Yeah.
We all know that. With not too much laxity of the skin, then you are likely to be a good CoolSculpting candidate. If there's a lot of excess skin, no, that would be a more surgical procedure.
Okay, so and somebody else asked, does CoolSculpting work even if you're overweight?
Yes, so the answer to that is, again, broadly, you can have CoolSculpting done if you're overweight, yes.
But it's only going to do small bits at a time.
But it's only going to do small bits. So what, and it can, and if the ideal would be a patient who's average weight, with a few areas that they felt were just, they're not going to shift with diet and exercise.
Yeah.
There is no doubt in the USA and in Europe, there are people who get, and I hate this word, but debulked with CoolSculpting.
Debulked.
Who actually, you know, don't want a surgical procedure or are not suitable for a surgical procedure, and therefore just want to start to pare things down. Often it stimulates people to go on a really good lifestyle change.
It can do that, can't it? It can really kickstart that motivation.
Yes.
But debulking, I mean, would you need...
Oh, it's crazy. I mean,
6 or 8, 10...
Yeah, you'd need numerous sessions of treatment.
Which would be really expensive.
Oh, it's crazy.
Because it's like 800 quid
per cycle,
yeah.
I mean, it wouldn't be realistic.
Yeah.
So, you know, our job is to be honest and say to patients who are overweight, maybe consider a lifestyle changes and then come back and see us when we can start to make a real difference with what we do, and people feel it's worth their while, it's worth the investment they're making. So though it can be used in an overweight patient, ideally we try to steer a patient to more lifestyle changes.
And just use it to finesse the last bits.
Absolutely.
Because what it's really good for is the bits that are resistant to normal dieting. Because you know there comes what you can lose weight, you can shape up, but then there'll be that little pooch or the whatever bit that...
Yeah, absolutely. And I certainly feel a lot of people who, you know, certainly perimenopausally as well, the bit between the breasts and the navel, that bit where women lay the fat down there. It's great for that kind of area.
Okay.
So the big win areas are the ones you'd expect to be the big win. Abdomen, grabbing fat around the abdomen, we can really re-sculpt people there. Love handles, the flanks, back fat. Because even people who are quite slim, when you're wearing a t-shirt and the bra cuts
still digs in, doesn't
the
it?
back fat.
Yeah, we know that.
Yeah, and arms. Arms
and arms. Useful, fab. Lovely, down the end. You are going to stick questions down if we. Yeah, thank you. Best treatment for fine lines around the eyes.
Well, we know what that is.
Is it toxin?
It's toxin.
Which I'm saying because you know that there's restrictions on doctors talking about these things. So this is what if you feel we're hedging around or whatever. I can say these things, but Tracy, being a very responsible doctor, probably won't. But toxin is good because it will stop the muscles making the scrunching movements.
I mean, the idea, of course, as we know, is to the best thing for fine lines around the eye is actually that the gold standard is toxin treatment. And again, not to make the eyes look startled or just immobilised, just to airbrush, to soften off those lines.
Yes.
And of course, the only negative with using toxin around the eyes is that it wears off quite quickly. It does need to be maintained, and one does need to consider doing it every 3 months or so. But it looks, if it's done well, it looks really natural. It works preventatively, as you know, because it stops those lines becoming entrenched in the skin. Great easy win treatment. For lines, those fine lines underneath the eye.
What about that? Because there was another question which was exactly that. Someone's doctor had suggested toxin for fine lines under the eye, and I would have thought you don't really want toxin under the eye, do you? I mean,
you can put if you're very experienced with toxin around the eye, you can put little tiny drips just in specific areas to soften off those fine lines. And I do have patients that feel that's a great value.
Right.
The negative with putting a toxin under the eye is that it can, if it's not done well, it can actually pull the eyelid down a little bit, which doesn't look very good.
Like a bad eye lift when you get that sort of rounding.
So it's just be very careful. There are other things we can use. There are injectables that we can use, like Hydro Boost, Viscoderm Hydro Boost, that will actually
hang on, the Viscoderm Hydro Boost. Now, this is is it one of
these
injectable moisture treatments?
And it just gives a little bit of extra strength and hydration to the skin. And actually that's quite nice for people of a certain age who are finding that they're just getting those lines extending outside of the area that we can treat with toxin.
Okay, so Viscoderm Hydro Boost, it's from the same company that distributes Profilo, isn't it? What's the difference between it and Profilo?
They're both HAs.
Is there much difference?
They're both hyaluronic acid products, but actually Profilo you just wouldn't be able to use as close to the eye. With the Hydro Boost, it just needs to be little micro droplets of fine hydrating. It's developed for just that very, very fine, soft, delicate tissue. Profilo is better for the generalised skin. For neck, I mean, Profilo, as you know, we're digressing a little onto something else. But Profilo is particularly good for neck, face.
Yes, I loved it. I tried it on my neck last year. I was being distracted. I did. I find it took much longer for the results to show on the neck. I mean, because the neck needs more help generally, doesn't it? Because it's drier. And it doesn't have the oil glands, and the wrinkles on the neck tend to be a bit more entrenched, and it did help. But whereas on the face, I saw the results after about 5 weeks.
So
my moisturiser was just sliding off. It was all my makeup was sliding off because I was also using too much hydration. I just didn't need it because the skin was sort of moisturised from the inside. But in the neck, it was a nice result. I thought, this is something I ought to be doing on a regular basis.
I think what I think is more realistic with something like Profilo, which is regenerative. It remodels. It causes collagen and elastin production, which actually nowadays we actually are looking more towards. We're looking for these treatments that will give us a longer term sort of improvement in skin health. And that's really useful. So I think that actually, long term, we should be thinking of it as a way of regularly treating our skin with things like Profilo.
Brilliant. This is a lovely question, and I was distracted just by reading it and thinking, but I know you can help with this. I really want to go to Tracy's clinic, but I am too scared, says this, but not had anything done before. You think, okay, I sympathise, I totally sympathise. Sorry about this tickering noise in the background. It's the dog who's
Selfie the dog.
he's going around.
She's very sweet.
I absolutely know what you mean. It is quite a scary thing stepping up for aesthetic treatment of any sort, but your clinic is lovely. How do you go about reassuring a nervous potential patient?
Do you know, I think this is what we overlook a lot as cosmetic practitioners. I think we forget how daunting that first visit can be. I built my practice, as you know, Alice, right from the early days when it wasn't so well known, when it wasn't so in to do treatments, and I built it up from grassroots where we just developed really close, good relationships with patients. It was a very friendly. I had a clinic that wasn't the most flash clinic going, but I was proud of it being friendly, that people could access treatment without feeling inhibited or really embarrassed about doing so. And I hope that we've developed that culture throughout our clinic.
You've got really warm and friendly reception people,
Yes.
and you've got a team who all, I've been treated a lot by Tracy over the years, and a lot by other members of your team as well, and they're all so nice and kind. I mean, one thing I would sort of say to anybody who's a bit nervous about this is that cosmetic doctors are not out to monster you. That is a difficult thing, because I think because a lot of what we see of cosmetic work out there is really bad work. You don't notice the good work, you only see the bad work.
Well, it's true.
So when you see this bad work, my point being that it's quite normal to fear that if you step near a doctor and a needle, or a nurse and a needle, or a surgeon and a needle, they are going to do something unspeakable to your face. But they don't want to do that, because as a practitioner, you want people to be happy. They want you to go away and tell your friends about them. They want you to come back and have more treatment. So it's hugely in their interest to keep you happy. So if that means taking it very slowly and gently, you'd start with consultation, and then you'd leave people to think about it. They're not going to jump on you and say, right, you need this, that and the other, pin you down and administer it. It's not the way it goes. So.
I agree. I always say to patients, it should be a very good experience. It shouldn't be one that is daunting. I think once people come into the room, start to have the consultation, it's very collaborative. B, it's our job to just pitch that treatment and that conversation at the right level that you're comfortable with. And actually, it is based on trust over time. So what should happen is what should happen is you develop a trusting relationship with your practitioner, so that they start to know what you want, and you get to trust that what they suggest to you will look good. So I think we try and develop a culture where people aren't inhibited, where they feel very open to discuss what they want and what they don't want. I will tell people what I think they need. I'm very honest about that in that. But I will also say, but I want you to consider it and think about it and go at the pace that somebody wants to. And if they don't, I'd rather somebody had nothing done and walked away for another 2 years, thought about it and came back, than actually felt that they had to have something. So I think if someone came into us, they should get a very relaxed treatment experience and not feel awkward. But I know how that feels.
Yeah, and I mean, research going back a few years now has shown that people will wait many years while considering the treatment. I think for the older consumer that's still true. I think for the younger ones, which we've discussed for the papers before now, they will rush in much more keenly. But yes, it's perfectly normal to be thinking about these things. Talk faster.
Yes.
Sorry, talk faster?
Yes.
I do have a whole life being told to talk more slowly, and I got to talk faster.
No, it's true. But I do agree. It's very daunting. You should find somewhere that actually, is relaxed, and people that will treat you well.
Yes. Tracy, look at that question while I read this one, and we will stick in another question in the meantime, which ties into that, about should I go doctor shopping or should I stick with one practitioner? I think if you think about that, there's a very obvious answer to that, but I shouldn't really answer that, because I have, for work, and I have tried every this and every that, because I like to go to different doctors and see how they all work, what they all do. Everybody works a bit different. Is that fast enough? But what would you say as a professional, Tracy?
Okay, I would say this, that you know how I feel about this. I think that it's absolutely appropriate to do your research, maybe go and see a couple of practitioners that you've either had. The best way, of course, as we know, is personal recommendation.
Yes.
But that's difficult, because sometimes it's very, very confusing. And the other thing is, with the influence of media and social media, you can be sort of slightly brainwashed into thinking a certain way that may not necessarily be the right practitioner for you. So it's a bit confused. This is what I would say. Do some research. Go and see 2 or 3 people, see how you feel about those people. And I would guarantee that you will generally get someone who you feel is the right kind of fit.
Yes, because that's so important, isn't it?
You probably find, you think, that person probably is my person.
Yeah, I'd be okay with them.
Yeah, that clinic is probably my clinic. And then I would say, again, I talked earlier about trusting that relationship over time. Getting to know what you want is very, very important, and developing. Some of my patients I've been seeing for 20 years, 25 years. And then I think the misconception perhaps people have, and it's only my personal view, but I see it a lot as you do, is that people sort of search for this wonderful doctor that will do this wonderful thing that actually what I find is actually there's probably a few key people in the industry, maybe more than that, who would develop equally good treatments.
Yes.
And once you get to trust someone, it's like working on a piece of art. Try and stick with that person and because that's the way you'll get the very best treatment results. So once you developed a position of trust, I would say as long as that person can offer all the offerings that are available, I would actually urge people to stick with who they got and let that doctor do or nurse do the best for them.
Because often a lot of the questions I get are sort of, should I do this or should I do that? And the awful answer is it's not usually a one thing or either or, it's a progression of maybe start with this and you might want to relax a few wrinkles, then deal with some pigment and then look at some...
it's a bespoke treatment for each person.
Yes.
And that's what I would say. And over time the goalposts move, people actually require different treatments, and it's about having someone who understands that. Whoever that person is needs to understand that over time. And not every treatment will work for everybody. That's true. And not every person will like every treatment. That is also true.
Oh, it's funny because somebody says they love you guys. They say, I read that out rather than the question. But thank you, Divine. We'll say therapy and radiofrequency for lifting and tightening. We've got quite a few therapy questions. So, therapy and radiofrequency for lifting and tightening. That's a sort of statement on the question, isn't it? I mean, you do a lot of it, but just let's look at aspects of therapy on this. If I'm having toxin and fillers and therapy, which do I have first?
Okay, the short answer to that is do the skin tightening first.
Okay.
But what we have to also be, again, very direct and honest about is that, again, patient selection is key with all therapy. With any device, what we call device treatment, and all therapy, as you know, is probably regarded as one of the gold standard of skin tightening. It's FDA cleared, so therefore it's proven to work. We want to make sure somebody gets the optimum result. We don't want a substandard result. So what we would do is assess a patient. I would normally recommend all therapy first, followed by underpinning with fillers strategically placed so that they give more lift and support. So we can be very clever with the way we use our fillers to showcase the therapy result. And then we would normally use light toxin treatment then to just treat a little bit around the eyes or up the face or even on the neck to give some added lift.
Whatever sort of still there.
It depends. It depends. So what I call that normally for most middle-aged people, it's the golden triad of treatment. You'll often tighten, underpin with filler and airbrush with the toxin.
Fab. And what about therapy for jowls? Somebody else, because the difficult thing in here is that I've written a bit about therapy and I get a lot of comments, mostly negative comments, coming in saying therapy was terrible, therapy didn't work, therapy was so painful, therapy melted my face, all these things which it
and we
should
can't
not
get away.
do.
We cannot get away from that kind of comment, and we're not trying to here. I think actually this is what I'd say. As long as that assessment has been correct, where we are very direct about what the expectations are of the treatment, you should be able to get a very nice, pleasing result. So we will often combine again for jowls. There's no point trying to treat heavy jowls in somebody who needs a facelift. I mean, that's
you're not going to get that result. And would you also take CoolSculpting to the jowls?
Yes. So if somebody had actually a fat pad here and we had quite heavy, fatty tissue here, and we'd already assessed whether they were a surgical candidate or whether they were a non-surgical candidate. Non-surgically, we would often debulk. Again, I hate that phrase, but it expressively. We would reduce the fat pad here. We would tighten with the oil therapy, and then we may use some form of filler, maybe if necessary. So maybe something like Volux, just to give that extra lift on the jawline. So you're combining treatments to get best effect. Where I believe you get substandard results is when you've not used enough combinations of treatment to give the best effect. So I say...
so it's got to be a plan from the start, not like a...
Yes, because I'm assuming here we're treating a patient who might need more than one treatment modality. Some people only need one treatment modality, particularly the younger patient.
Yes.
So we have to be careful. We have to be really careful about what we consult.
So,
in India,
that question was, which is better? radiofrequency or R-therapy?
Well, I'm going to be biased.
That is difficult.
Okay,
Yeah.
I'm going to be biased because then I think any practitioner uses, this is what I'd say. Both are proven to lift or both are proven to have some collagen remodelling and new collagen formation.
Yeah.
Oil therapy, because it's so precise, we can visualise all the layers. We can visualise the SMAS muscle, which is the muscle that surgeons tighten when they do a facelift. We would assume that, therefore, that would be likely to give a more predictable lift. Though many years I've used radio frequency as well and got quite a nice lift. I think actually radio frequency is very good for the eyes, for example. So for fine tissue, I think radio frequency is incredibly good. I think for the rest of the face, oil therapy, for me, in our hands, is actually probably, for us, we get more predictable results. And we often combine a little bit of radio frequency with a bit of oil therapy on the brow to give a brow lift and an eye lift. We can use combinations of these treatments. So what I would basically say to that answer, I sound hedgy, but I'd say this. Whoever you go and see about it, make sure that you're seeing the results that they achieve with their technology, and then you can gauge whether you think it's going to be a good enough treatment for you.
Yes, particularly because even with machines, and this never ceases to amaze me, even with a machine-based treatment, it is kind of dependent on the operator, isn't it? Different operators will get different results out of the same machine.
I agree. And that's what we have to, again, be aware of.
Yeah.
It's technique dependent. So it's actually the person that's doing it needs to be very good at what they do.
Yeah.
There is obviously we need to select the right kind of candidate. If we don't select the right kind of candidate, we're unlikely to get the best outcome.
Yeah.
The third thing, which is very, very important, is that we may select a very good candidate. We may be using a great operator on that, or a person with a great technique. But if that patient doesn't follow the advice that's been given, and this is actually quite crucial to this conversation, if we've written a program and said, this is what we believe will give you the best result. If a patient doesn't follow that advice for whatever reason, then they are setting themselves up for failure.
Okay, yeah.
So actually, it's a bit like I say, when we're assessing a face, you have to perhaps take the advice that's given, decide whether you want to embark on it, and then do the journey. And only then are you likely to get best result.
Yes. Thank you. Moving on to this one down here. What is an 8-point lift and how much is it? The how much depends on other parts of this answer. So an 8-point lift, it's a protocol for Juvederm fillers is where it came in, wasn't it?
That's where it originally came from, yes.
And it's come to, people will say, oh, I do an 8-point lift. And when patients come to you and say, do you do the 8-point lift? What do you say to that?
Again, straight answer is yes, we can do an 8-point lift. I think this was the strategy there by the Juvederm users was that it gave a sort of, as you know, mapping that if we actually put filler deep to lift and support the face in certain key areas of the face, it ended up being sort of 8 points, it would actually give quite a nice subtle lift to the face.
And an overall
global, a global approach that was very subtle and soft, which was great. And depending on how much filler that was required, depended on how much that 8-point lift cost. Yeah. So some people who are quite young, again, I would question whether we need to treat the young people. But actually it could be 1 mil, it could be 2 mils, it could be whatever. But actually I think if you look at really what happens in clinical practice, that 8-point lift is too simplistic. What we will do is do a bespoke treatment.
Yes.
And that 8-point lift may end up being a 12-point lift or a variation.
You'll do what needs doing, won't you? And you won't put X amount of filler in position 1 and X amount in position 2. You're going to completely adapt.
It's bespoke.
So, yes.
So therefore the fee will be dependent on that treatment. And though we consistently say we are there to try and hold people in aesthetic suspended animation, we're trying to keep people, I have got my teeth in, so that's fine. We're trying to keep people looking effortlessly good all the time. We're trying to make it look completely seamless, as if nothing's been done. We still need to do enough to make the difference. Otherwise, it doesn't look better.
Yes. Yeah.
So it's just enough, but not too much.
Is there any such thing as an average
Fee?
the whole treatment with filler? I mean, it's going to be 2,000, 4,000 depending on how much you use, roughly.
Yeah, it does depend. If you're doing a sort of 8-point lift, it may be depending on the clinic, depending on the practice. You could be looking at anything between sort of 850 up to, well, however much you want. You know,
I had
£4,000
worth put in my face. No, not
but
very
that
huge.
was an 8-point lift, though.
That was
no.
everything.
That was a strict,
that was
and
that was a more is more new protocol. They don't like me saying that phrase, but yeah.
No, but that is actually more. And again, I don't want to put people off because there are plenty of our patients that have variations of the 8-point lift, which are minimal treatment. Just to give that lovely lift, but we often
you can get nice results
lovely,
with minimal treatment. But
but the treatment you had is more the kind of treatment that, say for example, I would perform, which is strategic deep filler placement in the temples, across here, along the jawline. To get, again, that treatment would have been expensive, which patients do understand when you explain the strategy, but it still looks really natural. It still looks really, really good.
And it would have normally been done over 2 or 3 sessions. It was just because I was writing about it. It was all done in one
and there's so much. I mean, and I have, I am the kind of person that needs that kind of treatment because I'm of that age where an 8-point lift probably would do 0. A 16-point lift.
I don't feel any more grown up or older than when we first met, although that was a long time ago. I mean, we've both got daughters the same age, so usually whenever I would rush in for treatment with you, most of the time, whether you're doing Botox in my armpits or propping up my cheeks or something, it's like, senior school applications or GCSEs or college applications. They both now graduated. Our girls are both 22.
Yeah, absolutely. But we went through all that same stuff
I look
together.
at your face and your face looks just the same and lovely like it always has. But
we're
getting on a bit. Now, do we know what the long-term effects of filler are? Because
again, great question, isn't it?
And I think this was in reference to somebody who was, if they start it now and they're going to go on using it for 30 or 40 years, because it's only been around, hyaluronic acid fillers have only been around really for 20 years, haven't they?
And the honest truth is we don't know any longer than that. Mm-hmm. So who are we to say, it'd be fine. Yeah. The only thing we can say is, yes, we have that much history behind us, so we know that they have been injected into people's faces for that long, and actually they seem to be very biocompatible, very skin friendly, etc. We know that in clinical medicine, i.e. a non-aesthetic role, in orthopedic surgery, we can inject exactly the same product into the synovial joints, so into the joints to lubricate the joints for osteoarthritic patients. We know that ophthalmic surgeons can put hyaluronic acid in the eye as well, and that for all kinds of medical reasons, and so therefore we know that actually it's very skin friendly, very body friendly, very biocompatible. So therefore there should be nothing that comes out in the next 10, 20, 30 years that suggests otherwise. So that's why we feel quite good, and they break down. They break down over time, and we can also dissolve them as well. So I think that's reassuring to patients.
And we hope that very much, because otherwise you and I are going to be some of the first ones melting wax in the faces.
They'll be digging us up around.
But we're doing all right so far, aren't we? Doing all right so far. Another little CoolSculpting add-on question, which was for the fat on the inner part of the knee. You can treat that bit with.
Yeah.
Can you treat that bit with CoolSculpting? Is it tricky?
Yeah. If you can get it into the applicator.
Oh, okay.
So if you've got a skin like me, which is not very thick,
tiny,
it's that
tiny legs here.
The skin. Actually, if you can actually pinch the fat and put it into the applicator, it's treatable. So the knee fat is actually quite a nice, neat little area to treat with CoolSculpting. And inner thigh fat as well is great with experience, because obviously it's all about the visual, getting the thigh gap, getting all of that. I'm digressing a bit, but doing knees and thighs is a very, very successful area for CoolSculpting, and actually a really, really good high win. for patients.
Yeah, I was thinking, I have a colleague had that done, and it worked, but she got quite bruised for a bit. But I think you can be unlucky.
That's the only thing you need to be careful of as well. With every, generally speaking, you can get great results. You can get a little bit of bruising that hangs around for a while in those areas.
Yeah.
You can, in certain individuals, though it is rare, get a bit of slight sort of discoloration on the skin, but that will fade over time and disappear. So we just need to consult properly and work out those people, much like any procedure, Alice, you know this. There's all these ticks, all these gains, but we have to also just consider those couple of little things that might be an issue for a patient, and that's what's discussed at the consultation.
Yes.
So that's a thing that you have to always remember.
Absolutely, there's one other question here about how are we doing on time? Are we okay for time? Yeah, just about. Can I make my skin stronger when I'm getting older, says this person, and everyone says it's getting more fragile? What are the treatments? I mean, collagen boosting treatments, reconditioning treatments.
I think now we're in a whole new world, aren't we? And we're seeing new stuff coming through as well with stem cell and all this exciting stuff that's it's all out there. I think inside out is true. So I know collagen supplements, which you talk about, but certainly in terms of strengthening the skin, I think if we work preventatively, perhaps a little earlier than we would have done before. Again, I'm not suggesting that we treat the young. I'm saying that just as the skin's, just before we're beginning to see investing in, we know that topical treatments now tend to be much more effective.
So to topical treatments like vitamin A stuff, retinoids, vitamin C,
peptides, all those buzz, all the things you and I know work.
Yeah.
I think over time there will be even more exciting topicals that will come through that will help strengthen and keep the skin healthy. Sunscreens, we know. We know. Always.
Yeah.
And then like laser treatments or like things that keep that, as I call it, you're investing in your collagen bank.
Which just stimulate microneedling that force the skin to
keep
generate
the skin
more.
healthy.
Okay.
And investing in your collagen banks, you're doing treatments that may just keep your skin nice and fresh and healthy. And ignore that behind you, that's mine, sorry about that. So ultimately, doing all of that will make your skin strong, healthy and radiant as you get older and older. But also, we've got all these biostimulatory treatments like we mentioned earlier, things that will actually stimulate collagen and elastin.
Like Profilo. Like, does Viscoderm Hydro Boosters do that?
No, it's hydrating more.
And how the hydrators are like...
Sculptra.
Oh, okay. Yes,
Sculptra, which I love. I still love it.
Yes, because I came to you for Sculptra in like 2006, wasn't it? Fantastic. Sculptra is polylactic acid. It's a filler, but it's not really about a bulking filler. It stimulates your body to produce its own
collagen. So all those things, you can strengthen your skin.
Yes.
So I think as we age, yes, of course our skin deteriorates. We cannot hold back time, 100%, unfortunately. But we can do things now. We understand more.
Yeah.
And we do things more. It's all about skin health, looking well, looking healthy, not looking contrived, not looking freaky, just looking really, really good for one's age.
That phrase is, it's fine when we use it ourselves, isn't it? I find if somebody says to me, you're looking good for your age, I actually take quite some offence to it.
It's a knockback. I do agree. It's a real knockback.
Yeah, and you should think, oh God, because I'm so possibly ancient, but I suppose it's all right. But
it was always tricky.
It is.
So it's and what do you think about collagen supplements?
Oh, collagen supplements. Oh, I'm a big fan of collagen supplements because of the quite a few of them have decent research behind them that shows that if you have enough hydrolyzed collagen, if you have between 3,000 and 7,000 milligrams in a daily dose of hydrolyzed collagen, that will boost collagen within your skin. And people say, oh, why don't you just eat more protein, because that would break down to collagen in the body. But hydrolyzed collagen, the presence of that, it gets through the digestive system, it gets picked up in the bloodstream.
It's more accessible.
It's more accessible, it gives your body more to work with. But the other part of the thing is that when there is more hydrolyzed collagen on the loose in your bloodstream and is available for skin repair, the body presumes there must have been a terrible wound to it or something. Why is all this collagen being made? It thinks it must race to make even more. So it kickstarts your own collagen
That's really
producing whatever,
Cells.
which isn't fully understood, and it is something that people are looking at. But I will take lots of different brands of anything that comes my way. I take a lot of Totally Derma, Absolute Collagen. There's various things like Skin Glow Collagen, which is altogether too sweet and have to dilute it by about 100 times. Skin Aid, which again I find that very sweet. There's lots of them, so they're well worth investing in. Or the other one, the vitamin C I took, actually that produced really good. Those is Ultra vitamin C, which I'm not paid to say. I pay for it, I buy it. I do eat that consistently because that I did a 3-month trial on it, and that produced noticeable improvements in hydration, elasticity, and in collagen within the skin.
And it's going back to that concept of inside out. The fact is that we know that superfoods, and also there's more data coming through that if the best way to take these is by natural food. So often we can't normally eat enough to do that, but actually all this stuff will all help the way we age and the way we look, and also the way these treatments look. As well, because it will make us
so we can't just neglect all the basics and come along to your lovely clinic for propping up, can we? We need to be thorough and look after yourself. Well, Tracy, thank you so much for coming along. Really
thank you, Alice. Always a pleasure to talk to you.
Thank you very much everyone for joining us. Okay, bye now.
Thank you, bye.
And okay.
Are we off?
And now,
were we off?
say